Well, hello everyone, and very welcome to this LinkedIn Live event. I'm Natalie Donback, and I'm very excited to be hosting this event today. We'll be talking about the impacts of climate change on health and really how we can better respond to that intersecting problem. And the science is very clear. If we continue to burn fossil fuels and add carbon to the atmosphere, it will have really serious consequences to both our health as humans and the health of the planet. But while the planet doesn't really depend on us, we do very much depend on the planet not being, being habitable and not making us sick. And just to give you a few examples of how climate change is already impacting human health, we're already seeing more frequent and more intense extreme weather events, such as droughts. We've also seen the devastating floods in Pakistan last year, more food insecurity driven by droughts, and also a rise in infectious diseases such as dengue and malaria, which are spreading to totally new, different areas around the globe. And actually, a well less known consequence of climate change really that struck me is kind of this link between rising temperatures and kidney disease. And last year in Bangladesh, there was a health clinic that started to see just a real increase in young, otherwise healthy men coming into the clinic in need of kidney transplants and dialysis after having worked abroad in extreme heat in countries such as Qatar, preparing for the World Cup, and they were really ill. And some people were able to see this connection with climate change, and even though it might seem far-fetched, the body under extreme heat becomes dehydrated, and that in turn creates these crystals in the urine that can scar the kidneys and lead to chronic kidney disease. So definitely the impacts are there. We're already seeing them. COVID-19 was another very clear example of how really putting pressure on the natural environment can have spillover effects on human health. And zoonotic diseases is just one of them. So there's no doubt that climate change is a really big global health threat. In fact, the World Health Organization has dubbed it one of the biggest threats to humanity and human health. But yet, the responses to climate and health are often siloed and separate from the work of delivering healthcare. So today we're going to be looking at that nexus and really how we can bridge some of those gaps, tear down some of those silos, whether that's in implementing programs or accessing financing, and have a look at that solution that Planetary Health could potentially provide. So already a few years ago, scientists and doctors and others came together and they looked at this intersecting problem of climate and health and really saw that there was this planetary health lens that could be a really, really useful tool for tackling some of these problems. And what this means, in short, is really taking a sector-agnostic and holistic approach to health that recognizes these interconnectedness between human health, animal health, and planetary health, really. So for the past 4 months, Devex has been hosting a content series called Planet Health, and we've been digging into exactly these topics. So I invite you to check it out. I know my colleagues will be posting comments with a link to the series in the comments section, so please keep an eye out for that. So yeah, we've been really discussing some of these issues in depth together with our partners, Catholic Relief Services, Cordaid, and Sanofi. So thanks for making that possible, and you'll actually hear from some of them here today. So yeah, we're here to discuss exactly how we can move the needle on these issues and translate this approach into tangible action on the ground, and really what's needed to create this shift in thinking moving forward if we're going to address this multi-layered crisis. And we'll take your questions, so please submit your questions, start thinking about them already. You can just drop them in the link here, in the comments section, sorry. So we'll have a look at those later. And yeah, to kick us off, I know my colleague Richard Jones recently caught up with Dr. Jemilah Mahmood, who's the Executive Director of the Sunway Center for Planetary Health, and they have some really great insights that they wanted to share with us.
Many thanks, Natalie. My name's Richard Jones, Editorial Director at Devex, and I'm delighted to be joined today by Dr. Jemilah Mahmood, Executive Director of the Sunway Center for Planetary Health. Dr. Jemilah, welcome, and thanks for joining us.
Hello, Richard. It's good to see you again.
Well, perhaps we can start, Dr. Jemilah, by helping to set the scene for our audience today who might not be so familiar with the term planetary health. So what is it? Why is it useful? And why is this conversation so timely?
Thank you, Richard. For many years, as a medical doctor, as a humanitarian, doing a lot of work in public health and emergencies, I knew that, we were trying to save lives, but the needs just grew bigger and bigger, and the world is facing both complexity and uncertainty. And, whatever we were doing was really like putting a band-aid on a large gaping wound. And COVID was a tipping point for me, looking at, how do we address the underlying drivers that have led us to where we are today? And otherwise, we would continually just, putting those band-aids. So in 2015, planetary health emerged as an extension of the public health domain, really offering us a new paradigm to take complex challenges and address them through systems approaches. Planetary health basically is about the close relationship between human health and the planet's health, without which both cannot thrive, right? You can't have the health of humanity without the health of the planet. And, it's about breaking silos, forcing systems thinking, about acknowledging that we live in the Anthropocene and human behaviors drive a lot of our decisions and destruction in our development as well. So confronting those realities, but also acknowledging that underpinning this as well is the issues around governance, around communications. How do we look at education for the generations to come? And because everything is connected, it was the right time to look at it through a planetary health lens. COVID is recent, it's still present, it didn't come out of the blue, everyone was affected. From our health, social, and economic conditions, the disruptions were the largest anyone in living history has experienced. And the challenges we face coming out of this pandemic are even more daunting. So we need a new approach, and planetary health offers us this approach.
And given your career to date, as you mentioned, as a medical professional, public health advisor, a humanitarian, what inspired you to launch the Sunway Center for Planetary Health in 2021? What steered you to using planetary health really as a lens, as an approach to solving these set of problems?
As I mentioned before, we need a completely different way of approaching our problems. We need to have a systems thinking approach. And I thought of myself as an Asian living in a region that is, at high risk of disasters, also, sometimes the epicenter of disease outbreaks, but also an emerging economy, a rapidly developing region. I felt it was so timely for the region to have a center like this to, allow this opportunity for the region and the global south to offer some fresh ideas, hopefully, to the rest of the world, our own experience, our own, cultures, and how we deal with some of these challenges. And putting it in a university allows us also to interact with young people, and I think that that's where a lot of my focus is going to be now, and in creating a think and do tank where you do research, you build knowledge programs, you teach and educate young people as well as corporates and other university students, but also the doing, connecting the knowledge and learning to engagement and influence. How do we take that learning? How do you translate good research into policies? How do you translate that into action on the ground?
And what would be your biggest sort of takeaway from your first year or so at the center, and what's the next frontier for your work there?
Yeah. What I've really enjoyed is that, first of all, we've been able to really engage with policymakers. We managed to put planetary health into the language of the 12th Malaysia Plan. So look at development through a planetary health lens, acknowledging the planetary boundaries that we need to try to, protect and not breach. Already so many are breached, but how do we make sure that future development is more conscious of the fact that there are limits to what our planet can, tolerate in terms of destruction and disruption. And I think, those policy making engagements are really important. Secondly, is on the knowledge front. We have built a 7-week module that we are testing out on our undergraduates. And it's been really interesting how they've said, oh, now we understand that the SDGs are really important, but understanding planetary health tells us here's what we need to do, here's what our leaders need to do, and here's what we need to make noise about, right? To push for this change. And from 2024, every undergraduate enrolling into the university will have to complete a 7-week course that is mandatory. And whether they're studying engineering or biomedical science or arts or computer science, they will have to apply that knowledge to their work and in the community. So in a way, it's about leadership development and making sure that those future decision makers will know the decisions they make have an impact on planet and on human health.
And so in that context, how does this help to future-proof the health and climate sectors? Looking more broadly, do you have any concerns about climate preparedness in the global health sector? How can the sector better prepare for climate impacts?
I do. I really do. When I speak to medical colleagues, particularly my friends in the private sector or in other hospital settings, they're aware of climate change. I think everyone is, but they aren't as aware of its projected impact on the future burden of disease and the impact of health practices and infrastructure, right? Many are not even aware that the health industry contributes 4% of all global greenhouse gas emissions. And if it was a country, the health industry would be the 5th largest emitter in the world. Now, this is significant. So I would say that we're missing a conscious link between the practice of health in clinical settings and the reality of what's actually happening beyond the walls of these institutions. So I'd recommend to them 4 initial steps. One is to have amazing tools at our disposal to spread wisdom and knowledge, medical journals, communities of practice, professional associations, and of course the links between academia and medicine. We need to better harness these to articulate the linkages that I was talking about. So we start from there. Secondly, we need to demonstrate leadership from the health sector, both to be an example to others of what needs to transform, starting with ourselves, and clearer and more joined up thinking about what must I start and stop doing. How do I reduce emissions from my work and personal life? Joining a green hospital movement, Healthcare Without Harm, for example, is a great organization. The networks of physicians for planetary health. The other thing, of course, medical practices, or rather practitioners, health practitioners, are among the most trusted people. And how do we leverage on that trust? How do we be advocates? How do we also use that trust to educate? And the big questions, how can we help these big questions? Who can help us to start to answer them and lay out a plan of action? I think we need to collectively look at how we make our practices greener, a huge piece of work. Where's the money for this? Pharmaceutical companies, for example, need to be encouraged to dig deep and provide resources, especially those who have made massive profits off the back of the pandemic.
And so looking at sort of moving this from theory to practice, what are some of the challenges that policymakers will face? And I'm thinking here of integrating climate change thinking into health programs and vice versa. How can we do a better job of breaking down these barriers and breaking down these siloed approaches?
Yeah. I really appreciate the question, Richard, but I'm going to turn it around, right? I think first I'm going to say this is about us, all of us, right now. It's about our negative impact on biodiversity and the environment. This is what we need to turn around, our collective behavior. So we start with ourselves. Secondly, climate and environment aren't medicines, pills, or a piece of new technology that we have to integrate into health programs. They are an existence too. This is bigger and far more threatening than anything we've experienced before. So for me, the use of language is really important. And here, planetary health is clear. Achieving planetary health, that is creating conditions that will allow humanity and the natural systems we depend on to thrive now and in the future, will require a great transition where we all learn to nearly do everything differently, such as producing and consuming food, manufactured products, energy, constructing and living our cities, managing our natural landscapes and resources, coexisting harmoniously and responsibly with social, artificial, and digital technology, and recalibrating the stories we tell ourselves about our place in the world, our relationship to nature, and what it means to lead a good life. So, of course, recognizing and acting on these links between climate and environmental concerns and health programs and vice versa is also a key part of this transition. So, we need to do really difficult things, which humans simply aren't very good at. So, we have to shift to systems approaches and break those silos, as I mentioned earlier. And what does it mean? It means health professionals and academics need to look beyond the safety of their professional spheres and recognize that our current definitions of health fall short of what is needed to truly sustain health, the recognition and inculcation of the fact that everything is connected. So I think, we ask our students to give a planetary health pledge when they complete the course. It's to explain these connections between human health, environment, social, and structural determinants of health, and the need to embrace those planetary health principles. And I think, there's no better time, Richard. COVID has shown us that the knock-on effects of a health crisis mean that everything is impacted. Now is the time to truly internalize the fact that if we don't protect the planet, it won't protect us. And so humanity's health is threatened. So this now obvious fragility that we are living in means that we need to be aware that linear approaches to solving problems will fail. The planning, financial, and legislative measures to protect the environment and biodiversity, the economic drivers we invest in, all have impacts on health. How we manage them will determine what happens next. But the reality is we all exist in a short-term system of political governance. So how do we think long-term? How do we force our leadership to think long-term? This is where an education revolution, as I mentioned, is required.
No, that's great, Dr. Jemilah. And unfortunately, time is short. But finally, I wanted to get your one piece of advice or a call to action for our audience today on how they can better respond to the health impacts of climate change. What would you like to see in the panel session ahead?
I think, first of all, to acknowledge the unbreakable link between our health and the health of the planet. How do we think out of the silos that are already created within the health community? You have One Health, global health, planetary health, and everyone is trying to create mini silos. We need to stop this, right? Otherwise we have no hope of all being able to do the big systems thinking that needs to be done. Call it what you want. The relationship with the health of people, planet, and everything in between needs to be our collective focus. So what we need is a completely new way of thinking and doing across different systems, political, social, environment, and health. And this is what I feel a planetary health approach offers.
Dr. Jemilah Mahmood, we'll have to leave it there, but many thanks for joining us for this special Devex LinkedIn Live event, for your perspectives and helping us to set the scene so eloquently. Thank you very much. And Natalie, back over to you.
Thank you.
Great. Well, thank you so much both to Richard and Jemilah. Those were some really great insights, I think, to set the scene and kick off the panel conversation. And it's also really great to see so many of you dialing in from so many places around the world. We've got folks joining us from, I think, Rwanda, Guatemala, Brazil, Kenya, and many, many more. So yeah, keep dropping your comments and questions in the chat, and we'll try to get to as many as possible. But without further ado, I would like to introduce this great stellar panel that we have lined up today. We've got Dr. Chalilwe Chungu, the head of programming in Zambia from Catholic Relief Services, who's calling in from Zambia. We've got Vanina Laurent-Ledru, Director General at Fondation S, who's calling in from Paris, and Dr. Remco van de Pas, Senior Research Associate at the Center for Planetary Health Policy, who's calling us from Indonesia. Welcome, all of you. It's great to be here. How are you doing today?
Fabulous.
Good being here.
Great. Well, we'll kick it off straight away. And we're really here to discuss some of the practical insights. How can we really implement a planetary health approach? We know it's great in practice, but how do we get there? And the first question was really around the barriers that we're currently seeing. What's currently stopping us from taking a planetary health approach? in this climate and health nexus, and what's making it so difficult to break down these silos that Dr. Jemilah Mahmood previously referred to. What's needed to really move the needle on these issues. Maybe Remco, you can kick us off, and then we can go to Vanina and Chalilwe afterwards.
Yes, and thank you, Natalie. So she was talking about breaking away from silos and working across sectors and thinking in a new way. I would like to take it a bit further by saying that for me, the injustices that we see, the crisis that is getting worse, is building on existing problems that we know in global health and international health for a long time. So for me, this is very much about climate justice and health justice, meaning that the inequities that are there because the way we organize our societies, that are there because basically wealth between the richer part of the world and the poorer part of the world have increased, is part of the structural drivers of the problems that we see at the moment. And we knew this already for several decades. I refer to the limits to growth reports from the 70s, and for the several actions that were already being proposed there. So although planetary health is a new angle of looking into things, in the end, it's about collaborating with those on the ground, those health professionals, those activists, those fighting for human rights, that challenge the power, that challenge capital interests, that also challenge profit making in the healthcare sector, and that enable people to at least being able to live within, to respect their social foundations, having access to education, to essential healthcare services, while at the same time respecting these planetary boundaries. And we really see that they're overshooting at the moment. But it follows a pattern. It follows a centuries-old pattern of extraction, of violence, of a coloniality mindset. So I see it as a kind of the top of an iceberg of much more structural problems that exist and that we need to try to redress as something that we can fix in the period ahead. And this is, I think, something that we need to explore together.
Mm-hmm. Yeah, no, thanks for that. So we're really seeing kind of inequalities play out on a global stage, and perhaps that's a bigger question of reconsidering even the economic model that we have driving those inequalities. Chalilwe, maybe you could tell us a little bit more about how some of these inequalities are actually playing out in places where you work around Zambia, and what are some of the ways we can actually create that change underground that Remco referred to.
Yeah, thank you, Natalie, and thank you for having me. And I just want to echo something that Dr. Jemilah said, that basically talked about having a holistic approach. And I think even Remco mentioned it. I would think that the problem actually, in terms of defining it, can be articulated using a socio-ecologic model where we see right down from the individual going up to the community level, right down to the national level, to the international level, which is basically the cornerstone of global health. So some of the inequalities we see in places where CRS works, and definitely Zambia is one of those settings, is poor access to adequate nutrition, poor infrastructure, poor networks. And so something Remco touched on, which is very important, is that if we're going to holistically tackle the issue of climate change, then we need a radical health in all or climate in all approach that really garners all partners. And when we talk of all partners, like, for example, when we are working some of the nutrition work that we do, we work with the communities, brainstorm with communities to develop solutions with them, and then escalate all those solutions right to municipal levels, subnational levels, and all those levels. for us to have a holistic response. So I would say those are some of the things that we see in our setting. Over.
Great. Yeah, no, we are definitely hearing a lot, I think, these days around partnerships, around being holistic, and, you know, the difficulty of translating that into kind of sustainable and long-term change. But Vanina, maybe you could tell us a little tell us how the Foundation S is tackling those issues on the ground. And also, you know, we're seeing a lot of, you know, displacement due to climate, and, you know, reaching the last mile has always been part of the SDGs, but there's perhaps a new last mile now with people being displaced due to climate, and you know, health facilities really needing to adapt and become more innovative in the ways of how they reach people. I know, for example, you've put a health facility on a boat in Bangladesh to reach people. So how is you know, how is it also a question of reaching those individuals?
Yeah, thank you so much, Natalie, and great to be here. So first of all, I want to say that you mentioned that I'm dialing in from Paris, and we're seeing that in Europe, it's the second warmest winter on record. We're seeing that the ice around Antarctica is at an all-time minimum. So we are having a perspective on climate change in all regions of the world. And yet, what I want to say is that we're in this poly-crisis world, and a lot of decision makers are not necessarily applying that climate change lens to every decision that needs to happen, be it on the economy, on defense, on other issues. And what I would like to advocate for is indeed what Dr. Jemilah and some of my fellow panelists have been mentioning, is that planetary health should really be the way forward to drive more social innovation, to force more systems thinking. I represent here Foundation S, which is the philanthropic engine of Sanofi, a pharmaceutical company headquartered in France. And our philanthropic engine is structured as a think and do tank. So we work on not only funding community-led innovations for climate change, we work on implementation science, ensuring that we can also identify what works and doesn't work, very importantly, in terms of climate change and its impact on health. But we also work on something that is very important nowadays, which is what type of collective advocacy we need to perform. And here, let me pause for a second. What I see very important is that a lot of people now are aware of the impact of climate change on health. We know that climate change is expected to cause more or less 250,000 additional deaths per year. And that's just the tip of the iceberg. But of course, climate change is also impacting the ability of people to access medicines or to get to a clinic. And it impacts food security, water, air pollution, everything we know. What we don't know, or what we don't realize very much, is that I feel that we've been having something that I will call almost a colonial approach to climate change. And I would argue that we need to really decolonize our approach to climate change. And what I mean by this is that a lot has been invested in mitigation. Some money has been invested in decarbonization, meaning how can we reduce the 4 to 5% of healthcare emissions, of CO2 emissions that the healthcare sector represents. But what we've not done is to focus on adaptation. And what we're seeing is that today, only 0.5% of the entire multilateral climate finance is allocated to health. What this signals is that there's very little money going to those people that need to live with climate change, that need to live with new health impacts from climate change on the health. And to be very practical, you mentioned that we've been supporting an organization in Bangladesh. We can come back to it, but yes, the last mile has gone even farther. While it used to be already very difficult to reach people with health interventions in hard-to-reach communities, those hard-to-reach communities have become even more vulnerable. to give you the example of Bangladesh, there is this need to provide healthcare on a boat because it is the only way now to reach people that live in chars. Chars are those alluvial islands in the middle of the delta in Bangladesh. And while they used to get maybe 1 or 2 floods a year with monsoons, now it's moving to 5, 6, 7, 8 times a year, even last year, that are with floods that are wiping away their entire communities. And nothing can get protected, even with elevated centers. So that's the way we've needed to adapt, provide healthcare on a boat, but it's just one way. So we need to work collectively to find others.
Well, that's a great example. And you also mentioned financing. You know, that is always such a big question whenever you're talking about health or climate. That is also always one of the top questions. And I think we also had a question from the chat around the role of new and emergent financing mechanisms, whether that's the Green Climate Fund or the Loss and Damage Fund that was agreed at the last COP. From where you're sitting, you know, what's the role of financing really in also breaking down those silos? When we look at health, it's often, you know, very disease specific even. So how do we move from that, a siloed approach that's, you know, even targeting specific, you know, diseases and health areas, to taking that holistic approach that we've been discussing?
Yes, so I'm happy to answer that question. So as I said, I work at Foundation S, but it's very important as well to consider what we at a company level at Sanofi can do together. And taking a holistic approach means 3 things for us. It's really how we adopt a 360 degrees view to climate and its impact on health. So first of all, we're taking that holistic view to reduce our global footprint in the way we operate our business, in the way we deliver care to healthcare patients. So one thing that we've committed to is to achieve net zero by 2045. And we've set for ourselves an interim target because you don't go from that to net zero in one day. So the interim target is to reach carbon neutrality by 2030. And that includes 100% renewable electricity, energy efficiency, a carbon neutral fleet. But it's not just that. We know we need to optimize our supply chains. We know we need to digitize our clinical trials, and we're very much in the process of doing that. We're also supporting digitization of care providers. But all in all, what you need to do is to take an end-to-end approach, focus on the treatment, on the prevention of heavily impacted therapeutic areas, such as infectious diseases, chronic conditions, allergies, because they're all much more prone to climate. We're also looking at how we need to adapt our portfolio. We're also working with our main suppliers because our Scope 3 emissions represent 85% of our emissions. So it's critical that we work with suppliers. And as I mentioned, that's just one piece on the mitigation. Then there's the whole decarbonization agenda, where we're working with other healthcare industry providers to ensure that we can work on helping patients reduce their own emissions, helping the whole healthcare sector change the way we're giving care, and finally, adaptation for vulnerable communities. And there, it's mostly for low, middle-income countries that we're focused on, because that's where the funding piece is missing. And we can come back to it once other speakers have also provided their views. But it requires cross-sectoral collaboration. And it's only through blended financing that we can succeed. So philanthropy is only going to be a portion of it, and we will need others to chime in.
Yeah, and
Natalie.
Chilwell, I was going to go to you actually, because I know when we were catching up earlier, you highlighted the need also to take a much more long-term vision of financing and not think such short-term kind of project-based solutions. So I wanted to hear from you and what you're seeing in Zambia. What kind of financing would you really need to move the needle on this?
Yeah, so thank you very much. And thanks to Vanina also for setting the stage on blended financing. So, like climate the climate finance architecture is very complex and it's evolving as well. And, it comes through multilateral channels like UNFCCC. So, like Paris Agreement financial mechanisms, there's Green Climate Fund, which, for example, is funding the current Zambia National Adaptation Plan. And so I just to underscore what Vanina said, in order to achieve the amount of investment that is needed to be able to build resilience and resistance, we really need all hands on deck. And Sanofi, I think, is taking a great lead in terms of showing leadership and what an example of, corporate sector, private sector is, not only from their operations side, but also from their work as well. I know that they've got grants out for community level work as well. So I just wanted to highlight that, even when we're thinking of financing, we really need to be thinking about how it benefits that rural family. And so I want to give you an example. We have a project here in Zambia called the Youth Climate Core Project. And in Static Relief Services, we have similar projects where we work with communities to start with education. So, we said that the data and the science is known, but there is also disparities in the level of knowledge, just, across right down to the community. And I think, even Dr. Jemilah had said that. And I think the initiative they are doing in terms of education is very important to ensure that there's no knowledge divide there. Then all that escalates. So governments also need to increase domestic funding into climate change and health. Health systems need to also, adapt. There's a lot of damage that health systems themselves, health facilities do by their daily operations. And so just that awareness of greening is important. I was saying Zambia is one of the highest countries in terms of deforestation. And you find that communities don't even have an appreciation of some of that. But it takes money to get down to the communities. It takes money to adapt systems and right down to building infrastructure. And so really we need an all hands on deck approach and blended financing using corporates, multilaterals, for profits, not for profits. And as you said, the silos, because sometimes resources is not our problem, but it's actually the coordination and partnerships. A colleague of mine told me recently that the definition of collaboration is uncoordinated bringing of people together who are unconsenting. And I think that's what needs to happen. And that happens through strategic frameworks to just ensure that all the funding arrangements are collated so that the impact is broader. And as we said, during our catch up earlier, that really, the climate change discussion is not so much for us nowadays, but it's for the preservation of the planet. So the bill is high, but the outcome is we can't even count. And so because right now resources are scarce, and so there's a diversion of resources to other things, like, for example, some of the world events happening. And so there's a lot of, pooling of resources left, right, and center. But we need to refocus as well and just ensure that we get those resources into looking at priorities, and definitely climate change and health is a big focus area, looking at the fact that climate change is the biggest existential threat to the human planet right now. Over.
Yeah, thank you. And Remco, financing is a massive issue, so I wanted to get your perspective on it.
Yes, and let me play here a little bit the devil's advocate in this panel. I don't think there's shortage of finance globally seen. There is massive finance available. We have billionaires that are stocking their capital in financial markets that are not being used for health and development perspectives. They're shooting rockets out of the orbit, and still we see that there are still so many people not having access to basic health services. So it's really about then targeting that existing finance and ensuring that it's available for let's say planetary health means, which means, and I'm really talking here from a justice perspective, and I hear our colleagues talking about the blended financing and the partnerships needed. But in the end, it's about strengthening public institutions and public finance and public democratically controlled means to make such goods equitable available. And the inequities that exist in healthcare, where in many low and middle income countries, simply because of commercialization and privatization, let's say quality health service is only available for the middle class or people who are able to get a basic health insurance. That's a real problem. Moving forward there means that we, and one of the research that I'm doing at the Center for Planetary Health Policy is about the economic drivers and pathways to overcome these challenges, and research and also experience from let's say the civil society field shows that one of the problem is also how let's say the Western world and has also via development funding has not so much been a solution, but rather a problem for many countries that wanted to have their autonomous space, to increase fiscal space, their taxes, etc., to strengthen their institutions. I'm talking here about structural adjustment. I'm talking here about austerity. I'm talking here about the role of the international financial institutions like the IMF and the World Bank. I'm talking here about debt and debt restructuring. All of that is crucial to make these planetary health actions possible. And we should engage as development sector also with this debate, rather than only relying on the finance that becomes available via philanthropy and via NGOs that are working in this field.
And Remco,
yeah.
Oh, no, I didn't mean to interrupt. Sorry, I just wanted to interject maybe on this point that you've just made. I think philanthropy is not the answer to it all, for sure, nor is any private sector or NGO contribution. There's a very good comment in the chat, and there's this comment I wanted to make. One, my plea for blended financing comes from the fact that actually we need to help redirect funding to national adaptation plans. Not every country has a national adaptation plan. And I think if we can ensure that already the funding is going to these and that we all push for those local plans, that would be a big win. And within those plans, I think we also need to make sure that there is a strong and well-funded health chapter or health component. And that's where the blended financing piece can come into play. We've just supported a project for Malawi to do so with the Green Climate Fund, together with Save the Children as well, and of course the Malawi national government. And it's very important because it's to your point, Remco, right? You cannot and absolutely should not replace democratic or any local policymakers. We will all win if we can strengthen local structures. And the comment in the chat that I noted is that what comes towards adaptation for climate change should not be taken from ODA, from overseas development aid. Otherwise, you will create an even bigger problem. And that's a tough balance to maintain. And that's going to be a delicate advocacy art that we will all need to perform collectively, I believe, to ensure that ODA is not redirected to climate change issues at the expense of gender, women's health, and any other development or health issues.
Natalie.
Please, go ahead.
Thank you. So I appreciate Remco's viewpoint on equity, it being a moral issue, and social justice. And I do agree, that I do agree with Vanina definitely that you don't have a one size fits all approach. When you have a big problem, definitely you need a lot of solutions. But I would like to talk to, there's a colleague in the chat that mentioned that what can African communities do where the government isn't responding. And I think that's very important, because we have that experience as Catholic Relief Services, and even myself coming from a lower middle income country, we have that basic experience. And so the things that, radical change doesn't start from the top. It really starts from within communities. And there are several examples of how, world movement started from one small idea, or what was thought to be a small idea at the time. So, for example, we work with communities to do climate smart agriculture. So these are communities that ordinarily would be using destructive methods to use to do agriculture, like maybe cutting down of trees and things like that. And just that, knowledge equipping goes a long way, and once cascaded to community level can really foster, a mindset shift and systems change. And so small things like, for example, we work also on gender issues. And so you find that there are years of culture ingrained within people. So we also look at gender transformative work that really gets to empower women and break some of the norms that are destructive. And when we're talking about climate mitigation adaptation, we really need those marginalized communities and ensure that there's no one left behind. We had a flood in Zambia recently, which was effects of I can't remember what cyclone. Sorry, I can't keep up, but came through Mozambique. And so, with the flooding, you had already fragile households, give in because of not adapting. And when I say adapting, I mean at that local context in terms of anticipating some of these perennial issues. Moving to highlands. And so there's a lot that we can start in terms of local-based solution. For example, on our, I keep mentioning our food and nutrition resilience and agri projects. We really help the communities with low-cost, high-impact solutions that we take to scale, while recognizing that yes, there is a place for social justice and getting philanthropic movements to join in. But you will agree with me that anthropogenic activities are what have gotten us to this point in the first place. And if we don't stop those behaviors, this will only get worse. And hence the need for us to really start those change ideas at community level, while also lobbying at the global level, so that we can meet in the middle to have synergy and reach some of these milestones earlier.
Absolutely. And, some of you have already mentioned kind of the link with government, with policymakers. And as we see with a lot of, at least on the health side, it really takes close collaboration with governments, with ministries of health, in the case of also bringing in climate, then, that's where ministries of environment and climate change come in, especially for, countries such as small island developing states. And I wanted to bring in this question of the role of working with governments, and have you had any experiences, in those collaborations that you could share? How can, governments even, get better at integrating a climate lens in their health, infrastructure and programs, creating more resilient health infrastructure, and really taking this holistic lens that we've been discussing? Have you seen any examples of that?
Maybe I can answer to that. I think policymakers, also local policymakers, they're crucial in driving this agenda. They need to be engaged, and on this, looking at it from a multi-level approach. So to understand that it's at the community level that you that basically, let's say, health policy makers and the professionals work with the local community groups that are there, that are involved in the planning and the decision making, what to do, but that it goes up insofar that so many countries still need to develop a kind of an environmental health strategy. So this is where collaboration needs to take place as well. Realize, and this is coming back to my earlier remark, that in many places, public institution capacity and knowledge can be actually limited because of poor salaries in the public sector, because of other reasons that it's quite hard to have a strong a government response in relation to driving this transnational agenda, because they also need to interact regionally and globally. So one thing that we need to think of is this capacity building and the investment that is requiring to work across different sectors to get this going. But this cannot only rely on voluntarism or on, let's say, the willingness of people itself. There needs to be investment in these global public goods. And while we talk a lot now about the domestic investment, there is requirements and internationally, and I think the UN has a crucial role here, as well as regional institutions like the European Union and the African Union, to have that shared responsibility, that shared finance available to build that intersectoral capacity, that education also that is required to make that happen. That's a little bit my thinking on it.
And
Yeah.
from my perspective, I think it's very important to highlight that we actually need much more preparedness and collective preparedness. And what I mean by this is Dr. Jemilah alluded to the 4 to 5% overall emissions that the healthcare sector has, which actually is the same amount as the aeronautics sector. So we speak a lot about airplane emissions, but healthcare overall is about the same weight, which means that we need to reinvent how we provide care in a lot of settings. And in order to do that, that's where authorities, the governments, can actually incentivize greener innovation practices, can help get, Remco, you spoke about regulations, but if we have simplified, globally harmonized regulations around this, that would be extremely helpful, but also ensuring that we can leverage what is being done in terms of forecasting. Right now, forecasting is being kept in with the climate specialists, but it's not informing a lot of the health specialists, and certainly not the private sector, which needs to develop the medicines, the vaccines that are going to be impacting the diseases of the future. And the diseases of the future, we can already predict a number of them in the infectious diseases space, but we cannot predict all of them. So all of this forecasting capability needs to come together. Then we will need also joint investment in R&D to boost greener technology, not just in the health sector, but the health sector will definitely need a lot of that. And we spoke about education. Education is going to be paramount for healthcare professionals, because they will need to learn what are the most environmentally friendly therapeutic strategies that will become a thing in a not too distant future. But patients also need to be made aware of the care decisions, and that those care decisions are never neutral on the environment. So all of those issues, call them maybe opportunities in the future, we need to ensure that, again, we apply the planetary health thinking to it, or system thinking to it, because if we keep working in silos, as we are in the private and the public sector, all developing our own forecasting capabilities, all trying to put our own financial engineering behind it, all trying to put our best R&D behind it, will fail, because we will reinvent exactly the same practices that we have seen hurting us and the health of our planet in the first instance.
Yeah, do you want to jump in just real quick, 2 minutes, and then we'll make sure to do audience questions as well.
All right. So I just want to thank Vanina for that point in terms of R&D. And I think R&D is the reason why, we're able to resume travel today, because we had a very big example in terms of the COVID-19 pandemic. And so I think all those elements come together. But I also want to respond to something that Remco said about the role of government and working with governments. And then he mentioned something about, government financing and salaries being low and improving. And I do acknowledge that. But I also want to tell you, speaking from a perspective of someone who has worked with government and also has collaborated with government now that, I'm working for a non-profit. And I want to tell you that a lot of government colleagues are very motivated. CRS in several of our countries, our strongest partner is the government. And even now, our government has shown tremendous leadership. They've set a Ministry of Green Economy and Environment, and a lot of policy shifts recently, haven't been ones that needed a lot of investment. So I think, what government represents is leadership. I'm not taking away from the need to have public financing come into this space, but I want to say that the paucity of it is not a reason for there not to be the first steps in terms of having leadership provided by governments. And there's still a lot of other governments that need to take leadership. There's also a very good comment in the chat where someone says, is climate justice respected by the developed world by having adequate health services or supporting financially the developing world to improve their health services? I think we should look at the root cause. Right now, we have a lot of, from the global perspective, we have a lot of finances going into a war. This is my personal view. It doesn't represent my affiliation, but I think it's very immoral when you look at even some of the underlying nuances behind a war such as this, or the perpetuity of it. But if you look at the consequences, you have internally displaced people, you have climate change effects that are just worsening. And so when we talk about, morality, social justice, I think there's a lot there to talk about. In terms of prevention, conflicts create a lot of burden in terms of health systems, in terms of communities. And so, we need all hands on deck to just look at how a lot of investment can go into prevention. Conflict resolution is a big arm of conflicts. Right now, because of conflicts, you find a surge in infectious diseases for which we were bordering elimination. And these are all consequences of all these effects. And so there is really a big, broad discussion around, I agree, Remco, the need for government financing, but leadership by governments, and this is governments in all areas, developed and developing countries. I think the developed world governments have a role in leadership in terms of just changing the world order of events so that we can focus on more pressing issues. 2023, we should really be looking at issues of, climate change and health for all, not looking at going back to core systems and things that we had, graduated from, so to speak. Over.
Yeah, no, we've definitely seen a lot of donor funding, shifted to responding to the war, and needs are growing. The drought in the Horn of Africa as well. We just see needs growing, but not necessarily the funding in the same pace. And someone posted a really good question in the chat and said that the problem with interventions to date and funding on climate interventions is really that donors put a lot of conditions. Sometimes there's limited flexibility to that funding, and for a problem that is so multidimensional, that flexibility is really key. So how can organizations really best engage donors? How can donors improve this flexibility? Anyone wants to jump in on that one?
There is what I know from the health sector. There was already the sector-wide approach from several years ago. So to have that flexibility and to be coherent, to follow the original the original Paris 8 effectiveness principles would already help, but it requires trust. It requires trust in local partners, in governments, to actually do what is needed now across sectors to work on these issues. But what and this is referring to what Chalilwe was saying, trust at this moment in the international community is lacking because of the way we engage with wars, etc. And that trust building, understanding each other, also at that local level, working with the different partners is really needed there.
Yeah, thank you. And, we're very short on time, but I would like to just kind of go around and ask you for kind of a final call to action, something you want, the audience to go away with. What is kind of the one thing that's needed to, put this into practice, the many kind of big picture questions that we've discussed, whether that's, completely changing how we approach policy or how we partner with local organizations. What is kind of that one final call to action in 30 seconds or less? And Vanina, maybe we'll start with you, then Chalilwe, and then we'll end with Remco.
So I think you heard me. My plea is think 360 degrees approach to climate and its impact on health. And now is the time not only to reduce emissions, but also to support vulnerable communities that are living with climate change every day and that need to adapt to it. So a call to more financing to go towards adaptation.
Great, thank you. Chalilwe?
Yeah, I just want to add on donor regulations that I believe if you're putting your money anywhere, you need to ensure that your money is spent prudently. And so, as recipients of donor funding, I would like to attest to just prudence with spending people's money. And so as Catholic Relief Services, we represent the community and we work in the communities, ensuring that each person is given the opportunity to reach their full potential. And so with any discussion, any humanitarian development discussion, I think the community voices are very important. And so we advocate for community voices that should be represented at all levels, and the morality as well as equity issues should come to the fore with the community voice at hand. And that will ensure holistic planetary health that respects marginalized people, women, children, people living with disability, people infected with HIV, and all groupings of people that are left behind in most developmental agendas. Thank you very much.
Great. And Remco, short and sweet, please.
So planetary health is about, in the end, we have a shared destiny as humanity. We have, although there are huge inequities on this planet, we need to understand that in the end, we are dependent on each other, and that international solidarity that is required to keep it together, and also recognizing the human rights and the requirements of people at the globe. That attitude is required to basically engage many people, including, and I'm really talking from a European perspective. If we would like to make it across the world, then Europe, after 5 centuries of coloniality mindset, needs to give in and give space also for those communities and let them participate in setting their own development and health needs. And that is something I would wish.
Well, thanks so much to everyone. Yeah, thanks so much for your insights and for the experience that you bring to the table and to the discussion. And I'm afraid that's all we've got time for. I know there's some really interesting questions on mental health and the use of traditional knowledge. Hopefully we can get to some of those in our coverage here at Devex. And yeah, I'll just ask you all to kind of keep the conversations going. I invite you to check out Planet Health, this content series on planetary health that we've been running for the past 4 months. I know my colleagues are going to drop a link to that in the chat, so please keep an eye out. And yeah, thanks for everyone who tuned in. I know we've had viewers from across all continents, I think. So thank you for your comments and questions as well. And have a great day. Thanks, everyone.
Thank you, Natalie. Thanks, Remco and Chalilwe.
Thanks, Vanina. Thanks.
All the best. Bye-bye.